Good morning, Alex and friends. I'm Grace. Today is Monday, December 15th, 2025, and you're listening to Alex's News. The high in Riverside today is 78.3 degrees, with a low dipping to 53.9, so expect a mild day perfect for getting out and about. Coming up, we'll break down the reasons the House healthcare vote sidestepped, extending those key ACA subsidies, and examine what went wrong with ByHeart infant formula that led to a botulism outbreak affecting 51 babies. Plus, other stories on global tensions, local innovations, and more. All this and more on Alex's News. Stay tuned. This week, the House is set to vote on health costs as ACA subsidies near expiration. Reporter Ethan Guillen is with us. Ethan, what's at stake?
Millions of people's premiums and coverage are on the line, Grace. The enhanced ACA subsidies are slated to lapse at year's end, which is just over 2 weeks from today, December 15th, 2025. NPR's Morning Edition framed this as a push to avert rising costs, noting the subsidies helped stabilize the individual market. WUSF in Tampa also listed the House vote as a top domestic policy story this morning, tying it to broader economic pressures.
Remind us how big those subsidies have been. Who's affected?
The scale is huge. Enrollment jumped from roughly 12 million in 2021 to a record 24.2 million this year, and about 92% of marketplace enrollees received advance premium tax credits. According to KFF and Brookings, these enhanced credits eliminated premiums for many near the poverty line and extended eligibility above 400% of the federal poverty level. That made coverage affordable for middle-income families who previously got nothing.
And if Congress doesn't act, how will prices change?
Without action, analysts expect average net premiums to more than double for many in 2026. FactCheck.org and the Bipartisan Policy Center say insurers are pricing in a sicker risk pool if healthier people drop coverage once subsidies vanish. The CBO adds that uncompensated care could rise by billions, pushing costs onto hospitals and taxpayers. This isn't just sticker shock, it's ripple effects through the system.
Republicans argue the subsidies themselves drive up costs. What's their case?
House Speaker Mike Johnson said last Thursday, December 12th, that the credits contribute to, quote, sharp rises in health insurance costs, end quote. That view, reported by Punchbowl News, centers on market distortion and federal spending growth. It's true the gross cost rose from about $18 billion in 2014 to an estimated $138 billion this year. But KFF, Brookings, and CBO analyses point to offsets, like less employer plan crowd-out and reduced uncompensated care.
So what does the House plan actually do this week?
Republicans are bringing a package called the Lower Healthcare Premiums for All Americans Act. It was unveiled on December 12th, 3 days ago, and the Rules Committee takes it up tomorrow, Tuesday, December 16th. Notably, it does not extend the enhanced ACA subsidies that are expiring. Instead, it leans into transparency, alternative coverage options, and market rules.
Walk us through the main pieces. Start with pharmacy benefits.
The bill would force pharmacy benefit managers to disclose detailed data on payments, rebates, spread pricing, and formulary decisions to employers. Supporters argue PBM opacity hides costs that ultimately hit patients. Reporting in Insurance Newsnet says the goal is to pry open the black box behind drug prices. It's consistent with other House efforts on price transparency.
What about the insurance side for small businesses and the self-employed?
It expands association health plans so small firms and sole proprietors can band together. The idea is economies of scale might bring down premiums, though critics warn about skimpier benefits. It also formalizes choice arrangements, letting employers give pre-tax dollars for workers to buy individual plans. CBS News notes it's a shift toward portability and consumer choice.
I saw something about cost-sharing reductions. How does that fit in?
The package would restart federal payments for cost-sharing reductions beginning in 2027 to stabilize the individual market. But there's a limitation. The Guardian reports those funds couldn't subsidize plans that include abortion coverage. Supporters say it reins in taxpayer dollars. Opponents say it politicizes basic affordability tools. Either way, it's delayed stabilization rather than near-term premium relief.
Does this build on anything already passed this year?
Yes. The House earlier approved the Lower Costs, More Transparency Act with bipartisan votes tackling PBM rules and support for community providers. There's also the Healthcare Price Transparency Act, pushing hospitals and insurers to post actual prices and cash discounts. And the Patient Act would require true price postings for services. The American Hospital Association has long argued opacity fuels administrative waste, which it pegs in the hundreds of billions.
Democrats say this misses the main problem. What are they proposing?
They want to extend the enhanced ACA credits. A bipartisan group led by Democrat allies and Republican Brian Fitzpatrick introduced the Bipartisan Health Insurance Affordability Act on December 9th, 6 days ago, to stretch the subsidies through 2027. It also targets PBM spread pricing and pushes full rebate pass-throughs to patients. News from the states reports it's designed as a bridge while Congress battles over long-term reforms.
How much would people pay more if subsidies lapse?
The CBO and independent analysts estimate average annual premium increases around $1.200, with much higher hits for upper-middle-income households who currently qualify above 400% of poverty. Think up to $5, $600 more per year for some families. Over 10 years, CBO projects millions could lose subsidized coverage. The Century Foundation and Congress summaries echo those numbers.
What's the political temperature inside the House GOP?
It's tense. Punchbowl News describes a brewing moderate rebellion, with centrists circulating a discharge petition to force a vote on a temporary subsidy extension. NPR Illinois even notes some moderates threatening to sink leadership's bill if it ignores the cliff. That makes this week's vote count highly uncertain.
And where does Democratic leadership stand?
House Minority Leader Hakeem Jeffries has been blunt. The Washington Post reports he called the Republican plan insufficient and said it ignores the real drivers of affordability for everyday Americans. Democrats see the subsidy cliff as the immediate emergency. They argue transparency tools without subsidies are like a seatbelt without the buckle.
Given timing, can Congress still change 2026 premiums?
Not the base rates. Insurers filed their 2026 rates in spring and summer and got approvals by the fall, and open enrollment started November 1st. KFF and regulators say those filings assumed the subsidies would end, adding a few points for expected risk shifts. CMS told plans to model dual scenarios, but now says post-approval changes are impractical.
So if subsidies are extended, what actually changes for people?
Net out-of-pocket bills drop even if gross premiums don't. A retroactive extension would boost tax credits at the back end, lowering what enrollees pay each month starting in January or through reconciliations. Health policy outlets like AJMC note that's a realistic path at this late date. It's not elegant, but it's standard in how premium credits work.
What happens to hospitals and providers if nothing passes?
Analysts warn of a hit to revenue and more bad debt. Thomson Reuters cites projections of more than $30 billion in lost provider revenue next year if coverage rolls back. Hospitals would absorb more uncompensated care, and local taxpayers could face pressure. That's why hospital groups quietly back both transparency and coverage protections.
You mentioned earlier the broader history. Did subsidies slow cost growth?
Brookings and KFF argue the ACA era saw health spending growth moderate as a share of GDP compared with projections, especially right after implementation. That doesn't mean prices fell, but it contradicts the idea subsidies alone drove inflation. The uninsured rate for people 50 to 64 dropped sharply, which also stabilized risk pools. Those structural effects don't vanish overnight.
Some conservative outlets talk about hidden cost drivers. What are they pointing to?
Seeking Alpha and other right-leaning analysts point to administrative overhead, compliance costs, and plan complexity as stealth drivers. They argue layering subsidies on a complex system masks inefficiencies instead of fixing them. In contrast, Oliver Wyman and the Robert Wood Johnson Foundation find the credits made premiums more affordable without proportionally inflating base rates. That split shapes how each side defines reform.
What about the Senate? Did anything move there?
Not last week. According to WHYY and Iowa Public Radio, both a Democratic bill to extend credits for 3 years and a Republican proposal to expand health savings accounts stalled. That leaves the House as the only active venue this week. If it deadlocks, we likely drift into January with big uncertainty.
How are voters likely to react if this slips past New Year's?
CBS News and The Washington Post warn it could become a defining 2026 midterm issue. Around 22 million people could see immediate sticker shock or coverage disruption. That's a lot of constituents calling district offices come January. The politics rarely stay inside the Beltway when bills land in mailboxes.
Bring this back to the immediate calendar. What happens tomorrow?
The House Rules Committee takes up the GOP package tomorrow, Tuesday, December 16th, to set debate terms. Then leadership will try to move it to the floor later in the week. Any competing effort to force a vote on a temporary subsidy extension would likely surface around the same time. NPR's Morning Edition today called it a litmus test for compromise, and that feels right.
Last thing, Ethan. If you're an enrollee listening right now, what should you watch for?
Watch whether leaders add a straight subsidy extension to the package or allow a floor vote on the bipartisan bill. If nothing passes by New Year's, keep your plan and be ready for higher bills, because a retroactive fix can still lower your net costs later. And keep an eye on your state exchange alerts, because they'll explain any credit changes. The policy may be messy, but consumers can still avoid gaps by staying enrolled.
Ethan Nguyen, thanks for breaking that down as the House heads into a pivotal week.
Thanks, Grace.
Good morning. A nationwide recall of ByHeart infant formula is underway after a multi-state botulism outbreak. Reporter Chloe is with us. Chloe, what's the scope of this crisis right now?
It's one of the most serious formula safety scares in years. As of today, December 15, 2025, federal health officials have identified at least 51 infants sick across 19 states, and every one of them was hospitalized, according to CDC updates cited by NPR News from Associated Press reporting. The outbreak spans cases from December 2023 up through December 1st of this year, with a big cluster between August and mid-November. No deaths so far, but doctors say these babies needed intensive care.
And this is all linked to ByHeart formula, right?
Yes, the CDC and FDA say the common thread is ByHeart's whole nutrition infant formula, which has been recalled nationwide according to FDA.gov and the company's own notices. Investigators say they can't rule out contamination across every batch since the company launched in March 2022, a step first flagged in breaking coverage by the Columbian on December 10th. KSAT in San Antonio also reported that FDA and CDC widened the probe to every lot, given how strong the epidemiology looks.
What's the evidence tying the formula to botulism?
There's both lab and epidemiologic evidence. ByHeart's independent testing with IEH Laboratories found C. botulinum type A spores in 5 samples from 36 unopened cans across 3 lots, a finding the company posted and FDA corroborated on their sites. The California Department of Public Health went further. It cultured type A botulinum bacteria and detected toxin from an opened can fed to a sick infant. Batch 251131P2, according to CDPH, reports shared via state health sites and food safety news. The FDA also confirmed finding the bacteria in at least 1 can during inspections, something the FDA commissioner noted in updates reported by Food Poison Journal.
Do we know which states are seeing cases?
The CDC list includes Arizona, California, Idaho, Illinois, Kentucky, Maine, Massachusetts, Michigan, Minnesota, New Jersey, New York, North Carolina, Ohio, Oregon, Pennsylvania, Rhode Island, Texas, Virginia, Washington, and Wisconsin. NPR News emphasized that all of the infants were hospitalized, underscoring how dangerous this is for newborns. Ages range from about 2 weeks to roughly 8.5 months, per CDC data. And remember, infant botulism can take days to present, which complicates tracing.
Remind us what infant botulism looks like and how it's treated.
Doctors describe a slow, scary progression. It often starts with constipation, then weak sucking, droopy eyelids, poor head control, and generalized weakness. In severe cases, babies can stop breathing, according to CDC guidance and pediatric references. The only treatment is Baby Big, an antitoxin made from immunized adult plasma, which has to be administered intravenously, as the Colombian's HealthWire noted last week in a California case. Early treatment can shorten hospital stays and reduce complications, but it's a rare and expensive resource. That's why public health officials are pushing awareness, so parents and pediatricians act fast.
ByHeart is a tiny player in the formula market. So how did it get such a big share of these cases?
That's what set off alarm bells. The company has under 1% of U.S. market share, yet over 40% of formula-fed infants who needed botulism treatment since August had consumed ByHeart products, according to CDC epidemiology summarized on FDA.gov and reported by Food Safety News. That mismatch pushed the CDC to broaden its case definition on December 10th. When they did, they uncovered 10 additional historical cases dating back to December 2023 through July 2025, which weren't previously linked.
What exactly did the recall cover, and when did it start?
ByHeart announced a voluntary recall on November 11, 2025, and it's sweeping. Every can of its whole nutrition infant formula and single-serve anywhere packs, all lots and all sizes dating back to March 2022, is included, in coordination with FDA and CDC, as the company and regulators have posted. KSAT reported on December 10th that the recall expanded as the lab and case data solidified. Parents are being told to stop using it immediately and discard it.
Were there problems at ByHeart's plant before this?
There were warning signs. In 2022, ByHeart recalled 5 batches over Chronobacter concerns, and the FDA issued a warning letter in 2023 demanding stronger production controls, as CBS News and Marler Blog have covered. Inspections in January 2024, February 2025, and March 2025 at the Reading, Pennsylvania facility documented things like mold, water leaks, dead insects, poor sanitation, and inadequate protections against raw ingredient adulteration, according to FDA inspection reports. Those findings don't prove botulism contamination, but they speak to systemic gaps.
Is the company doing anything now to find the source?
ByHeart says it's auditing the entire supply chain, raw ingredients, packaging, transport, and bringing in third-party labs to test every batch, based on statements on ByHeart.com echoed by 10TV and Trib Live. They've also pledged a rigorous review of their manufacturing and quality assurance processes. So far, neither FDA nor CDC has pinpointed a definitive root cause. Investigators say the work is ongoing, and it may take weeks to map the contamination pathway.
For parents listening, what should they do today?
The FDA and CDC want families to discard any ByHeart formula immediately and note the batch number for refunds according to official guidance on their sites. Watch for early symptoms, constipation, weak cry, poor suck, and call your pediatrician or go to urgent care if anything seems off, because early antitoxin can be life-saving. The agencies also advise saving any used containers in case public health needs samples, though you shouldn't keep feeding it. State programs like California's Infant Botulism Treatment and Prevention Program can help mobilize Baby Big quickly.
What about getting money back or replacement formula?
ByHeart is offering full refunds for products bought directly from its website on or after August 1, 2025, and says it has 24/7 support lines, according to the company's December 10th notice and coverage from outlets like The Mirror and What to Expect. If you purchase through a retailer, they recommend contacting the store and the company's support to coordinate a refund. Meanwhile, pediatricians and WIC offices can guide families to safe alternatives. The CDC reminds parents to never dilute formula or mix brands in ways your clinician hasn't approved.
Have stores cleared their shelves? Or are recalled cans still out there?
Compliance was uneven at first. As late as November 26th, the FDA logged reports of recalled cans still on shelves at major chains: Walmart, Target, Kroger, Sprouts, Safeway, Whole Foods, and Publix, in multiple states, as Dallas News and Claims Journal relayed from FDA alerts. By December 10th, regulators said new sightings had stopped, and ByHeart implemented register blocks to prevent sales. Still, officials are asking shoppers to double-check labels in their pantry and report any recalled stock they see.
Did any of this formula go overseas?
In small amounts, yes. Some shipments went through online platforms, including Amazon, to countries like Argentina, Brazil, Canada, China, Japan, and South Korea, prompting advisories from agencies abroad, according to Economic Times and international reports. The UK's health authorities and the Philippines' FDA issued notices urging parents to avoid ByHeart products and follow their local return procedures. U.S. officials say infants overseas could face the same risks if those cans are used.
How unusual is an outbreak like this in powdered formula?
It's extremely rare. Powdered infant formula isn't sterile, but botulism clusters connected to commercial products are almost unheard of, according to CDC analyses and reporting from the University of Minnesota's CIDRAP. CDC's Dr. Jennifer Cope told lab partners in interviews highlighted by APHL blogs and Beacon Bio that the epidemiology here, so many cases clustered on one brand with tiny market share, argues against random environmental exposure. She said, quote, "The strength of the link overrides other explanations," end quote.
Do we have a sense of how quickly symptoms can appear after feeding?
The incubation period is typically 3 to 30 days after ingestion of spores per CDC and pediatric references. That lag is why case counts can keep rising even after a recall. Babies exposed weeks ago may just now be showing signs. Clinicians are being urged to ask about ByHeart exposure all the way back to March 2022 because of the broadened case definition. And the most recent known onset was December 1st, just 2 weeks ago.
You mentioned that broadened case definition. What did that change?
On December 10th, CDC widened it to include any infant botulism case with confirmed ByHeart exposure since March 2022, not just recent ones, based on FDA.gov summaries and food safety news reporting. That unearthed 10 additional cases from December 2023 to July 2025 that hadn't been tied to the brand before. Interestingly, the CDC says no cases have been identified between the company's March 2022 launch and that December 2023 point, suggesting whatever went wrong likely emerged later. It helps investigators narrow the timeline.
What are we hearing from ByHeart and federal leaders?
The company says it's cooperating fully with the FDA and CDC, and that the voluntary recall is out of an abundance of caution while testing continues. The CDC, for its part, was blunt in an online update, quote, "Laboratory tests have shown the formula is contaminated with botulism spores and can make infants sick," end quote, a line echoed across cdc.gov outbreak pages. FDA leaders have stressed that they verified bacteria in at least one can during inspections, according to Food Poison Journal's readout of commissioner statements. The tone from regulators has been unusually direct given the stakes for infants.
Are there legal consequences building?
Yes, and they're growing quickly. Parents in at least a half-dozen states, including Kentucky, Arizona, California, New York, Washington, and Texas, have filed suits alleging negligence, defective manufacturing, and failure to warn, according to filings summarized by ClassAction.org, Top Class Actions, and Marler blog. Some firms are exploring a class action to represent broader consumer claims, as Food Poison Journal and OFT Law have noted. Those cases will likely hinge on the lab evidence and inspection records.
Has the company's past with Chronobacter played into the current response?
It has shaped the scrutiny. After the 2022 Chronobacter-linked recall and a 2023 warning letter, the FDA had already flagged ByHeart's quality systems for improvement, as CBS News and FDA records show. The 2024 and 2025 inspection findings, mold, leaks, insects, sanitation lapses, added pressure for a sweeping fix. While Chronobacter and botulism are completely different hazards, the pattern suggests a need for much tighter controls.
What's the bigger policy conversation this is sparking?
There's a renewed push for tougher formula oversight. NPR affiliates and LAist have highlighted calls for more frequent unannounced inspections, stronger environmental monitoring, and clearer recall enforcement with retailers. Lawmakers are also asking if the FDA needs more resources to police a fragile supply chain, especially after formula shortages earlier in the decade. For now, the message is vigilance. Parents, clinicians, and stores all play a part in stopping exposures.
Final question. If a parent is worried their child had ByHeart, what's the first step?
Stop using the product. Check your can's batch number, and call your pediatrician immediately if you notice any changes. Constipation, poor feeding, weak cry, or floppiness. Because early baby big can make a huge difference, as CDC guidance explains. You can report illnesses to your state health department and submit complaints to FDA's MedWatch, which helps investigators track the outbreak. For refunds, reach out to the retailer and ByHeart support line and keep documentation. And if breathing issues arise, don't wait. Go straight to the ER.
Chloe, thanks for breaking this down. We'll keep following the investigation and the recall, and we'll post links to the CDC and FDA alerts for families who need them. Here are some other headlines. Australian leaders are tightening the screws on gun laws after the Bondi Beach Hanukkah attack that left at least 15 dead, a grim echo of Port Arthur's painful past. Prime Minister Anthony Albanese and state leaders agreed to urgently close loopholes, licenses limited to citizens, caps on personal arsenals, and an end to perpetual permits in favor of frequent vetting. Police identified the attackers as Sajid Akram, 50, killed by officers, and his 24-year-old son, Naveed, critically injured and arrested. Officials condemned the shooting as anti-Semitic terrorism, and New South Wales vows the nation's toughest gun laws. No ifs, just stricter clips. Across Southeast Asia, a border blaze is fanned into a second week as Cambodia accuses Thailand of airstrikes near civilian refuge sites, claiming Thai F-16s bombed close to camps in Ottar Minchi and Siem Reap and hit a bridge in Srais Nam, far from the frontier. Bangkok denies targeting civilians, saying aims are defined by characteristic and objective, not geography. The escalation threatens Cambodia's tourism lifeline in Siem Reap, placing Angkor Wat in uneasy orbit. With as many as 500,000 displaced and a recent ceasefire effort derailed, diplomacy is running on fumes, while the conflict's range keeps expanding. In Seoul, a special counsel's 6-month probe lands like a legal thunderclap. Investigators say ousted President Yoon Suk-yeol plotted his December 2024 martial law decree for more than a year to monopolize power, even greenlighting abnormal military operations to provoke the North. When no retaliation came, prosecutors allege he pressed ahead, casting the opposition legislature as anti-state. The portrait is of premeditation, not impulse, a self-coup script rather than a crisis ad-lib, with 27 already indicted and the rebellion case strengthened. Expect lawmakers to sharpen guardrails around presidential military powers, hotline now turning into a hard line. Hong Kong's Democratic Party, the city's oldest pro-democracy standard-bearer, voted overwhelmingly to disband, drawing the curtain on more than 3 decades of activism. Members cited the political climate and the need to close this chapter amid reported pressure and warnings that made the party's future more peril than platform. With the Civic Party and League of Social Democrats already gone, the pan-democratic camp is now a political ghost light on, but no actors left to take the stage. Under the Patriots-only model, opposition voices exit, and the city's once roaring chorus shifts to a controlled whisper. And in London, a debut with Decibels, New MI6 chief Blaise Metroelli warns of an aggressive, expansionist, and revisionist Russia, saying the Kremlin's export is chaos by design, a feature, not a bug. At RUSI, she described a battle space where sabotage, disinformation, and cyber attacks turn, everywhere, into the front line. As European leaders and U.S. envoys huddle in Berlin, the UK pushes for ironclad support to Ukraine while pressure mounts for a negotiated peace. Echoing the alarm, Britain's top military officer, Sir Richard Knighton, called today's security climate the most dangerous of his career, a chilling forecast from the Night Watch. That's all we have for now. Today's episode was made by Alexander King with GPT-5, Gemini Pro 3, Gemini Flash 2.5, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.